This is part of my brief CV. I am part of the scientific committee not only in ISWAM, in CAS2. I give more 230 conferences and webinars around the world, blah, 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 blah. But this is me too. This is when I share my time and my knowledge with people from Endymed in many parts of the world, here in Poland, here in USA, here in Thailand, here in Turkey, etc., etc. And what's happening here? What's something wrong here? Okay, and this is me too. I love sport, I love whiskey, I love travel, and I love this kind of conference. This is a sponsored conference. You need to know that. I have my conflict of interest. This is right now happening on me and all of you. We lost 100% of our capacity to create collagen cells year per year. Yes? Notice the age that you have. Summer it, and add that, and you know how many of your quantity or average of collagen cell you lost every year. That's why you need to make something to solve it. One of the ways to solve it is by the heat. Second fact, all of us know that we have a risk when we treat feed battery 3, 4, 5, especially because we are handled with the PIH. Just in this case, my brother and I and these Samoa fans last month in France because I love rugby, and in France was the World Cup. We are in the 4th position, close to be 3rd, only 3 points against difference against England. Okay, I said that we have to handle and we need to give a solution to this reduction of collagen cells. One of the ways to do it and to solve it is by the heat. And by the heat, for example, with a wave frequency. And it's really important, these two numbers. We need to reach inside the dermis at least 52 to 55 centigrades to stimulate the fibroblasts to create more collagen cells, but at the same time, don't reach more than 40 to 42 in the surface to be sure don't have any kind of burn, okay? This needs to be a safe treatment. Something happened, let me do it by this. Okay, when we apply this heat, we start to have two different kinds of reaction. One immediately and the other over the time pass by. The first one, immediately, we have a collagen contraction, okay? We love, Argentina love to perform asado. We said we are the best cooked asado in the world. When you put the meal over the heat, over the fire, with this size, when you finish to cook it, appear with this size. You obtain a contraction. In this case, the contraction of the fiber of the muscle. But at the same time, you can obtain the contraction of the fiber of the skin. Okay? This is the immediate reaction. But a long-term effect, you have a remodeling collagen, and all of them obtain skin tightening and wrinkle reduction. We can work in the 3 layers of the skin. On the epidermis for the rejuvenation, for example, with the handpiece FSR, I will talk about in a few minutes. Inside the dermis, obtain tightening with the microneedle, and in the lower part, in the hypodermis, induce it to the apoptosis, induce it to the fat cell death with, for example, the the contour handpiece. This is one of the goals of this device, one of the goals of any kind of radio frequency device. We can treat every type of color of skin every month of the year. No matter summer, no matter winter, we don't have the afraid of the PIH. That is a classical afraid of any kind of laser treatment. These are the typical P-Patry 304 of my country. I said I am fan of sport. These are all our idols. You know Messi, but we have Vilas, we have Ginobili, and we have all our my rugby team idols. And this is another fact. Asian skin and Latin American skin, the typical are, again, this one. We are in this scale of colors between P-Patry to P-Patry. That's why it's good enough if we look for treatment without risk of PIH. Again, to keep this phrase in your mind, all skin types every month of the year. That means your device never stops to work. The great clue is the first appointment, okay? You need to talk with your patient and talk carefully about the PIH and erythema and say that to him. You want a fast result, great changes, but you need to afford with a prolonged PIH, with a prolonged recovery time. Well, maybe the patient is a good candidate for laser, but majority of our patients don't want to suffer, don't want to have a prolonged erythema, don't want to handle to prolonged recovery time. They want to go fast to work, go fast to social activity. That's why you need to choose radio frequency. Again, between these two phrases, I try to avoid that. This is my typical case of laser treatment. During a complete week, or maybe in some cases 2 weeks, they need to afford with these caps. I showed this result in the previous session as a great result, because for sure it was a great result, but I need this kind of patient to sure handle with this discomfort, typical post-treatment recovery time. Or this prolonged erythema, not less than 6 months. Well, that's why if I want to sleep well, and if I don't have any call by patient during the weekend, I choose radio frequency. If we can handle, we can solve that, I am really happy. Okay. Maybe it's the way I put it that. Okay. Well, we have two devices. I choose this one because it's more powerful and I can choose the parameter as I want. I say that it's a menu de la carte because I can choose the depth, I can choose the energy, I can choose the duration of the pulse. The other device, the Pure, have previous sets. I can play with them. I prefer this one. These are the handpieces that I have in my center. And look at these are the versatility of the device. These are all the list of the treatment I can perform with the handpiece. And when we mention about a fractional handpiece, is still have a lot of a long list of indications. When we mention transdermal wave frequency, it's important to make a safe treatment. I said that, and I remember we call to you again the word safe. You have a motion sensor. If you don't move continuously, the device stops to send energy. First way to be sure you avoid hot spots. When you have a hot spot, you have burn. The other one tissue contact sensor. If the device doesn't sense that you are in complete contact with the skin, maybe it's not the same in this size, it's perfect with this size, with this position, it is going to stop again to send the energy. The second way to obtain a safe treatment. And the last one, real-time impedance sensor. The device sends us the energy that we choose, no less, no more. Oh, again. Okay, perfect. Another way to make it safe and make it effectively is if I need to treat a thinner skin like the eyelids, I need no more than 1.5 millimeter of depth of action, because under that I have the eyes and I can put this too much heat over the eyes. That's why I need a handpiece that only apply to 1.5 millimeters. But if I try to treat the abdominal area, 1.5 is not good enough. I need, for example, the contour, 26 millimeters of depth, to induce the fat cell to the apoptosis. That's why I need different kind of handpiece depending on the area I want to work. Are all the wave frequencies the same? No at all. No at all. If you have a classical monopolar wave frequency, you have great penetration but lower energy. You have the classical bipolar devices, you have great energy but in the surface. But you have the 3D, you can obtain the great penetration, really deep penetration and great energy. And this is obtained by this way. 3 polar positive looking for 3 polar negative, but all at the same time. That's why they repel by itself, okay? The first arc repel the second arc and repel the third arc. That's why we obtain penetration with the bipolar wave frequency. Again, the classical bipolar wave frequency are only in the surface. By this 3-way to repel between each others, we can obtain a deep penetration. Again, the same action, and looking the way I can reach all the thicker of the skin. And in motion, the same. We can remodeling the collagen cell by the heat, and we create a great ball of energy. When it was repelled by each other, we obtain this great ball of energy go down. It's important if you believe in the treatment, you need to be the first to prove it, to taste it. I was the first to taste it, this device. And here is the way we were sure we reach the energy to be successful. You need to reach at least between 39 to 42 centigrades on the surface to be sure you can obtain 52 to 55 inside the dermis. Here is in motion the way by bipolar energy we can reach all the layer of the skin. We start talking about the mini shaper to try to understand that. Look that. And 3 arc of positive pole looking at the same time only 1 negative pole. That's why they want to repel by each other and obtain this deep penetration. For example, to obtain this result, you can use a filler, of course. You can use a thread, of course. But I obtained this result without any injectable solution, only by heat. the same patient in the health profile view, and again, a great result. It's only about stimulation of the fibroblast. That's why it went to least month, 6 months, a year. Well, it's good enough for something that is safe and it's very basic for my patient and without pain. Or in this case, I don't see any kind of result. My patient don't see any kind of result. I put the patient in a vector system and looked at all the yellow arrow means gain of volume, increase the volume by the heat. Or in this case, I use the heat for obtaining contraction in the inner part of these tights. You can see here the beginner and here the final result, and the way we obtain light between these two inner part of the tight. By what? By the contraction of the skin. There's a concept, the ADI concept. I say 3 is better than 2, 2 is better than 1. If I can apply different kind of wave frequency, transdermal, fractional, and microneedle, for sure I can obtain a better result. And again, I was the one to taste it. I can say that it's comfortable, only a little heat, no more than that. For example, to obtain this kind of result, as a plastic surgeon, I can obtain better result with the patient, of course, but going to a surgery room, leave a scar on the eyelid, but with only send heat, we can polish the reduction of this wrinkle in the lower eyelid. My patient is happy, I am happy too. Or this lady was a colleague of mine from the university, have a complete education of plastic surgery. I perform, well, have blepharochalasis, LVAX, langophthalmus. That's why this is my result. I perform the blepharoplasty with a cantoplasty. Okay, it's good enough, but she still has this wrinkle in the periorbital area. That's why I apply the high fine and look the result. This is much better than that. And this is a surgical solution, and this is a surgical solution applied with the ABD in the post-treatment recovery time. This is not the case of mine, but give you the possibility to notice that the festum is a really problem, is really headed in any kind of hands or any kind of specialty, and by the heat we can obtain this reduction. We mentioned about the contour and the way we can get improved in the body. Again, I was the one to taste it. Okay, don't worry. Okay. Well, here I am, tasted the device. To obtain that, a tricky area, banana fold under the buttock, and the way we can obtain this reduction. Remember, but when you obtain apoptosis, the suicide of the fat cell is forever. Not is a case of the edema, it's not a case of reduction of inflammation, it's a case of kill this fat cell, okay? Or the same in this inner part of the tights. Again, it's going to be forever. Of course, the patient gain weight, my result is going to disappear. But if the patient is obtained or continue with the same weight, it's going to continue with the same result. Or look at this tricky area in the lower part of the bottom with this great amount of wrinkles. I was successful to obtain this reduction. Only by this device, only by this treatment, without pain, without any complication. Don't be panicked if you have this device or any kind of device of wave frequency and you have the paniculitis. It's not infection, it's only a fibrosis, it's only a matter to say our body that is close to go to the apoptosis. I show you that we are one patient of mine, my finger go down without any problem, my finger stop go down because we had a thicker, I have fibrosis in the skin. It's only a matter of time, don't worry, don't get panic. One of the fractional herpes is the FSR, it means fractional skin western facing. 112 pins, 14 column, 8 rows. The important part is that I can reach close to 3 millimeters of heating, that means in the face, all the thick of the skin, and I can erase, I can ablate 150 microns. Is 50% of a millimeters. That's what is safe. If you compare that with the laser, laser is more risky, with the FSR is less risky. I can choose between ablation and volumetric heating or act with the two at the same time. We can show you during the demo. And it's magic the way that I perform that. Always remember positive pole looking for a negative pole. But this genius act or perform this piece in the way that this negative pole jump between the bows, okay? And this way we are for sure obtain always 5 negative positive pole looking for this negative pole that is jump between the rows and between the column. And by this, we can obtain harmonious heat in all the area. Looking here in the video that I said, first we apply the heat and then look the way this heat go deeper by this volumetric heating emission. Don't worry about that. This is our endpoint. We need to obtain, in some cases, this little epidermolysis point. It means we obtain the good enough energy sending to the epidermis. And here I am again. I am the volunteer. I am testing this device, and I can say to you and to the patient that are prepared for be our live demo patients, that is not pain at all. My results, I want to mention later because usually I combine it, FSR with intensive. Intensive is our microneedle handpiece. Even by the heat, we obtain skin contraction, skin tightening, skin lift, skin remodeling, fibrillar cell stimulation, and improve the quality of the skin. Even all of that, Argentina can cook the best asado in the world. When we're talking about different kind of microneedles, it's not the same Luma hands. It's not the same a gray shot like this, okay? It's the typical way that any kind of microneedle work. A gray shot, all fast. This device go gentle because have a great torque. That's why the needle go inside really slow. You can see it during the demo, really slow. That's why I be sure I can reach the deep the skin that I choose. When you have a great punch, you choose, for example, 3.5 millimeters. You think you go to this deep, but usually you perform stacking because it stop in the surface of the skin. If you can go slowly, you can go gentle, for sure you can reach the deep that you choose. This is the handpiece and the tip, a total of 25 microneedle. It's a bipolar where you can see I can choose the deep, I can choose the duration of the pulse, and it's possible have an amount of 1,000 pulse. There are different ways to send this energy by microneedle. We have insulated and non-insulated. This is the first difference, okay? Insulated, only the tip acts. Non-insulated, all the needle acts. But when you send it in the way of fractional, it's like minimal pulse inside where a great pulse. And by this, you can send more heat to a swelling tissue. And all is a matter of the impedance. Impedance is the resistance of the pass of the energy to any kind of tissue. While we have high resistance in the surface and in the lower part of the skin, in the middle of the dermis, we have low resistance. That's why the energy flowing for this part, flowing directly in the dermis, in the area that I want to trade, in the area in the want to obtain the result, the contraction. I love to mention that it's like car on the high-speed train. If you try to look a high-speed train, you will look only one, because it's so fast. But inside of it, we have many cars, okay? This means minimal pulse inside a great pulse. I was invited as a speaker and part of the board of INCAS in 2022. I walk away to the corridors looking for interesting session. I saw this title, Microneedle Reflexology. I go inside, and it's important that was 6 different type of company have a crossfire. They say which of this company or which microneedle are the best. This guy, Hugh Cartier, is a friend of mine. He's the one in charge in INCAS about all the EVDs sessions, and this guy, Joseph Lesteler, is the one in charge of the clinical application in Endymed. This guy, Serge Dahan, at this moment was the president of the Dermatology Society of France. For my surprise, the first patient that he chose and he showed to the audience is a patient of mine, and the second patient that he showed to the audience was another patient of mine. When we talk about skin laxity, I start with the way I treat the jawline. I beat the skin. Why? Because if you're doing that, the needles can reach to the bone and reject it. That's why the energy is not sent to the layer that you choose. I prefer to do it by this. Pinch the skin and go directly to all the length of the skin inside, the length of the needle inside the skin. For example, this patient, in the front view, I don't see nothing, you don't see nothing, but in the profile view, look the way I can change the angle by the contraction of the skin. This young lady in the 40 don't have any indication to a surgery procedure. That's why I obtain this only by heat. Or, for example, this patient with this fatty under chin area, I perform first a liposuction and with a laser, but I have this excess skin. That's why I apply heat with microneedle. I obtain the contraction. This one is better than this, but this one is better than all of this, because I obtain the contraction skin. Another patient, same case and same solution. I start perform the liposuction with the laser, and after that I apply the microneedle. And look here, with the Vectra system, it start to appear the jawline because I obtain the contraction of the skin. When I mentioned the priority area is one of the treatments we are going to do it in a live demo. I start with the FSR and then I apply the microneedle. Look, my right hands, I am left. That's why I lift the eyebrow to be sure under the skin that I treat there's a bone to avoid any kind of injury of the eyes. I am doing that and I apply it directly on the skin, but under the skin I need to have bone. The same attitude when I start to use the microneedle. I lift the iron and apply to be sure under the skin I have bone. To obtain this kind of result, again and again, I am plastic surgeon. I prefer to do a blepharoplasty and I earn more money too. But the patient requests me a no-surgical solution. Look this excessive skin, look the contraction of the skin, only one session, and look after a close view, and look after 3 sessions, sorry. We appear the sulcus in the upper eyelids, and I have 3 folds, I have only 1 fold by the contraction of the skin. This is a patient of mine. I performed a facelift, a chin implant, and rhinomodulation. Good result. In the high profile, even that, good result. But in the front view, I take no total skin in the upper eyelids. That's why I have 2 ways to solution that. Return to the surgery room or apply this device and look the contraction that I can obtain only by this device. Young lady, a model, requests me a solution without any kind of post-treatment recovery time, and this is the way I can erase this little wrinkle, applying intensive microneedle and fractional tube. Look that and look that. All patients, 7 years, that have a little whiskey for going to the surgery room because have problem with the heart, have a problem with the blood pressure, and look the way I was successful to reduce the wrinkle and the folds, but at the same time with the FSR I can erase the lentigos, only lentigos, epidermal lesion, no melasma, of course. When mentioned at Ezequiel, this is the patient that I showed during the INCAS 2022. In the front view, in this view from the lower view and the half profile view, and the way I can obtain the reduction of the acne scar. To get it out with my patient, I always show him that this is a daughter of a friend of mine, and I take the photo after 4 hours to show the quality of the skin and the wetness that I leave on the skin as an endpoint. This is my endpoint. But after 24 hours, the patient can go to the university without any problem, only put a little makeup. Well, complication, it's important to mention that. We have complication. This is a colleague of mine, dermatologist, that during a demo in Bogota, Colombia, by the contract, I applied in 4 patients, but my colleague started to get excited and put it in the bed too and say, I'm going to be a patient, I'm going to be a patient. Well, that's caused that in some moment, I lose my control and apply 4 stacks. Stacks mean I apply the handpiece and shot several times. 1, 2, 3, 4 is too much. No more than 2 is safe. When you apply 4 stacks, it's risky. As you can see here, I burn my patient. But for my surprise, this patient looked for me when I was part of the committee in INCAS America. He gave me a great hug because the problem was solved, and he had a great result by this treatment. And here is the before and after of the patient without any scar, without any problem. And this is another complication of mine. Again, when I perform 4 stack, trying to obtain a solution in the anesthetic treatment. Believe me, stacking mode, I believe in that. I love the stacking mode, but only 2 or 3, no more than that. Skin laxity and fibrosis, I showed these cases of mine. I performed the liposuction and lipofilling on the bottom. Great result in the profile view. In the front view, even that is a great case, but if you can see in a close view, I have a lot of saggy skin, fibrosis around the navel. And look, the solution uses the microneedle. This is one of the patients that Seche Dahan showed up to the audience during INCAS 2022. And this is motion. I leave this excess skin and this bulk in the upper part of the navel. And this is what the solution. I here a photo to measure the weight. I have this bulk and I reduce the bulk by the microneedle. Okay? By this, I can obtain solution of my surgery by this device. When I'm talking about scar, I'm talking about only get improvement, no more than that. In this case, usually I use the FSR to polish the scar of, in this case, mastoplasty. Or in this case, I use first apply a combination of 5-FU corticosteroid to reduce this keloid, and after that I use the microneedle to allow me great penetration of this combination of solution. And here I use the microneedle to allow a great penetration and great absorption of this solution. To obtain that, remember that you treat the keloid, the only important is don't continue aggressive, don't continue to waste, it's only about that. Or in this case of this young lady is 4 years old with this, having this accident and this cut on the nose, I can polish with the FSR. Another case in which I combine filling and FSR, and I can obtain this result. This patient, I erased this tattoo with a Q-switch, picosecond Q-switch, and after that, this is what I saw. Usually when you try to erase the tattoo, during several months appear a phantom, a little PIH. The patient get nervous and anxious and look for another colleague to practice this, to cut the area. After that, the patient regret of this result and look me again to try to solve the problem of the scar. We start with this silicone gel, and after that I apply the FSR to obtain this result, an improvement in the quality of the skin. Stria, remember, nothing in the medicine can erase at all the stria because are similar like scar, but we can get improvement. For example, polish the area with the FSR. Or, for example, in this case, in abdominoplasty performed by me, I can help the patient reduce the quantity of wrinkles, or in this case, no wrinkles, stria, and get improved in the quality of the scars. There are many papers talking about that, talking about the way you can get improved in the scar by microneedle. This one is one of the best papers you can read because they perform biopsy, and in all the cases they obtain increase in collagen, elastin, pigmentation, and vascularization of the scar tissue. Well, the last topic is about hyperhidrosis and omnidosis. You can obtain solution on that, and you need to look for a solution because there's a lot of people to suffer at that. They are all our idols, from musicians, actors, even people from royalty that suffer this embarrassing moment, because usually people associate the sweat with the loss of hygienic, and even that it's not far. It's really far from reality, because they are really worried about that, and they shower several times a day. They change the clothes several times a day, trying to people don't notice about the hyperhidrosis on the armpit. We have two different kinds of glands, apocrina and eccrina glands. The eccrina glands are the responsible of the majority of the sweat. 90% of the sweat became from that. And the apocrina gland give us ceramide that, when can reach the skin and we in contact with our normal bacteria, produce an oxidation and a smell. And in some cases, the smell is too strong. We need to give a solution, for example, with the microneedles. This is the classical characteristics of the hyperhidrosis. Symmetrical, begin in adolescence. There's a lot of people suffer about that. 3 to 5% of all our population. It's been in my country, 2.5 million of Argentines that suffer about that, and don't have any kind of solution, or at least they don't know that they can reach a solution. It appears more frequently in Asians, especially in Japanese. It's hereditary. We have grandfather, father, and son with the same problem. And majority of the cases are in the axillary area, in the armpit. Okay, I mentioned that about the osteohydrosis. Some cases are acquired, but majority of them are hereditary. This is really important. While eccrina glands are in the side dermis and have a ductus to go directly to the skin, directly to the surface of the skin, apocrina glands are more deeper and need to go to the shaft of the follicles to reach the surface of the skin. It means that they are more deeper, close to 3 to 4 millimeters, while the eccrina glands are more surface, are more close to the surface, 2.5 to 3.5 millimeters. That means we need at least a needle to reach 4 millimeters to be sure we can obtain a solution for both kinds of eccrina and apocrina glands. This is the tips. We have, as I mentioned, 25 needles. I can choose the dip, I can choose the time, I can choose the intensity. We look for that thermocoagulation. We look little point of necrosis inside the dermis to be sure I can kill forever any quantity of these eccrina or apocrina glands. If you can do it well, we start with a minor test. It means we apply iodopovidone, and after that talcum powder to obtain a drawing. And you can compare this drawing before and after when you finish the treatment and you control the patient after a month. And in some cases, you have this kind of surprise, because same patients on the right armpit, this is the drawing, and it's completely different to the drawing on the left armpit. That's why I can apply different kind of treatment or different kind of parameters depending on this drawing. This is the first paper that I read about this illness and this solution by microneedle. This is my experience until today. I treated 208 patients by microneedle. All this experience give me the possibility to have an hour for my society. And this is the goal. I look for this kind of coagulation and necrosis inside the dermis. And this gave me the possibility to write a paper and publish in a HGPS. In this first publication, I found this 50% of reduction in 80% of the patient, but I still have complications. That's why I'm looking for a new device. This is step by step that you are going to see during the live demo. We apply the yellow polydown, we apply the talcum powder, we obtain a drawing, we take out the excess of this talcum powder. After that, we mark the area and we need to apply local anesthesia because it's a painful treatment. And after that, we apply the device. I made a live demo during the 2022 IMCAS Congress of this patient. And I have the possibility to show that my result to my colleague in the ISWAM Congress in Turkey. The classical post-treatment indication is maturing the area, avoid sun exposure during the bruising, avoid external exercise because you can hurt the area. And if it's another problem, I add the chlorhexidine because in some cases it's proof that these patients not have only staphylococcus, at the same time they have corynebacterium and anaerobius in the armpits. Close to the finish, and the complication that I mentioned, since the moment I changed my device, I don't have any other kind of permanent injuries. Classical contraindication or any kind of vacancy, as you know, pregnancy, pacemaker, local infection, or history of callus in the area you want to treat. These are my actual parameters. You want to take a photo of that, are really different of the classical indication of the Endymed company. There are many kind of paper talking about that. I don't debate it. I don't want the one to discover that. In the last 10 years, I have 30 articles talking about the efficacy of microneedle over the hyperhidrosis. Even in this great article, they compare the efficacy of different kind of indications of microneedle, and they found that there is a strong indication to use the microneedle for the hyperhidrosis. And in this paper, I love it because they compare the evolution of a total of 25 patients, and after a complete year, 50% of them still have a permanent result. Close to the finish, there are new indications, for example, for rosacea. I don't have experience with that, but I mentioned that. It's important to have many certifications of different kind of countries, many publications of our colleagues. And finally, my take-home message for you. I use daily, as I mentioned. Now, at this moment, my assistants are using with my patient at the clinic. All skin type, any season of the year. Another way to never stop to use the device. Avoid or minimize the possibility of PIH when you compare with laser. This is true. Avoid complication post-treatment. I mentioned that, and this is true. It helped me to improve my surgical solution, my surgical treatment. It helped me to avoid, in some cases, surgical procedures. There are new frequency treatment protocols. This is another good advice. If you look for frequency device, if you look for microneedle, look for a platform, because you have not only microneedle, you have fractional, and you have a different kind of transdermal handpiece. In the future, well, right now I am part of development or improvement in one of the handpiece, Maybe next year we have new indication and new treatment too. Invite you, all of you, in March in my country because I am president of this symposium, and all the speaker was invited to talk. The first one talking about minimally treatment, the other one talking about surgical procedures. A video of my conference, of my symposium. I prefer, well, here a little electronic tango. This is my city. Nowadays we are in crisis, political and economical crisis. We are really cheap if you want to have a great stay in my country. And I am part of the board of INCAS 2. I invite you to go to Sao Paulo in April. And you are invited to ISWAM, Ecuador in October of the next year. Thank you so much. I know the other colleague is going to show some results before and after that we start with the live demo.